I'm very pleased to bring on my colleague, Hanne Dalmut, the Senior Director for Partnerships Development at Concordia. Hey, Hanne, how are you?
Great, thank you.
For this conversation around tackling maternal and child mortality rates in Latin America by mobilizing and harnessing high-level private sector, philanthropic, and multi-stakeholder engagement. I'm sure we'll be touching on the Concordia Action Alliance as part of this conversation, which I know you are spearheading. So let's also welcome Dr. Elizabeth Peters, Global Health Partnerships Manager for Wellbeing Foundation Africa, and I'll turn it over to you, Hanne.
Great, thank you so much, Kevin, and welcome to the digital stage, Dr. Peters. It's wonderful to have you here speaking on behalf of Wellbeing Foundation Africa, which is, as Kevin mentioned, one of our regional partners and doing extraordinary work in the space of maternal health and well-being in West Africa. And with the goal of today's conversation, we really want to explore some of the alignment, synergies, and applicability of the learnings from your models, very community-driven, as they pertain to the challenges that exist on the same subject in a Latin American and Caribbean context. Because as we know, as with many of the SDGs, these are not geographically bound challenge sets, and some of the solutions could very well be scaled with local adaptation. And so with that, very happy to hear from you today. I'm gonna hand it over to you. I would love to have you please set the scene a bit, provide some context around maternal and child well-being in the Latin American and Caribbean region, as well as globally, and why this is an area that moves yourself and the whole Wellbeing Foundation Africa team to be engaged. What's going on?
Thank you so much, Hanne, for that lovely introduction. The thing with maternal health and child health is that it is actually a global issue. It's the childbirth in white Nigeria, it does not change in terms of its mechanisms to that of in America, in Latin America. It's the exact same thing. So when we have an issue to do with people that have issues of childbirth, we have to think of it from the perspective of how does it work for us here, how can it work for them there, and that's the exact same. It's a matter of is it an issue of anemia, is it an issue of delivery, issue of time to get to delivery sections, whatever the issue is, we can definitely use our mechanisms that work in Nigeria and Africa to help in America. Speaking on that, the Wellbeing Foundation is a very passionate coalition about maternal health care. It is our core area. We have other areas, of course, nutrition and so on, which I'll speak about later. But in maternal health, that is where we care about most. And our flagship program is the Mama Care program. And the reason why it's so powerful is because it follows the mother from beginning right to the end. And the end is not necessarily delivery. The end goes beyond delivery into neonatal, into the infant child care. So we say we are working to reduce indices of maternal mortality and neonatal child deaths as well. So we work our best to improve their healthcare all the way through. So when we work on Mama Care, we aim to educate the mothers, we educate them holistically about their personal hygiene, water, sanitation, nutrition, how best we can help them to be completely prepared for the delivery process, and then going forward, how to take care of the children, the newborn, breastfeeding practices, the importance of breastfeeding, especially. And as another thing that we see happening in Latin America, it isn't always being produced as the most important thing to do. So we also advocate for breastfeeding, especially safe hospitals that are friendly hospitals about breastfeeding, who promote breastfeeding as compared to use supplements and so on. And then go on to moving from breastfeeding to weaning into the health nutritional ideas, using what's in the surrounding, using what we have in our neighborhood. We don't advertise foods that they can't easily get from their back garden, and they can't afford to get it. So instead, we choose to promote what is available within their locality, which you can easily access at a cost that they can afford, and therefore we can therefore be sure that it will be much more sustainable for them, and they will go forth to proceed to have healthy families, and therefore we can cut that vicious cycle of having children that can't take care of their personal health and then become adults that can't take care of themselves, and then it keeps going. So over to Latin America, we believe that these same practices can be applied in reducing the mortality rates here in Latin America, and we hope that we can aim to change this situation positively using our models, hopefully.
So let's stay for a moment on that model. You mentioned that, oh, perfect. You mentioned that part of your success has been because the solutions you're providing literally come from the backyard of the mothers, right? I mean, it's so contextually driven. It fits in with who they are, their lifestyles, their economic opportunity and abilities. But my guess is that you rely on a number of local stakeholders to help with those information exchanges, to really kind of hear from the mothers in the way that you need to be designing your programs, right? And so I'd like to stay for a moment on some of the successes you've had in Nigeria. Think, please, about who some of your key partners have been. What are their profiles? Who's been instrumental to the delivering the kind of success year on year that Wellbeing Foundation Africa has? And how does that apply if you were to enter into a Latin American space? Who would you, if you could pick up the phone and call 5 people or 5 organizations, what type of profile would they have? What do you need to get started?
Okay, so firstly, I have to give the first foremost respect to our midwives. I think they are the ones who make this magic happen. We have the strategies, we have the platform, the paperwork and the nice speeches and everything, but they are the women who go down to the localities and speak to them, and they give them this, and they go in every single day. They're even online on WhatsApp. We have a chatbot as well, which we use to have an interactive meeting where we can speak to our midwives live and say, what can I do if my baby is vomiting? What can I, and this is that live, is that comfortable, they feel that
real-time support.
Midwives. That said, however, we do have other partnerships that also help to complement this, one of which would include our research partnership with Chelsea and Westminster Trust in London. They have helped us in our programs to do with research, to do with our feeding, to do with things on that angle there. They have been very supportive in that ground. Aside from that, we have worked with Alive and Thrive. That's another program of ours, and we worked with Save the Children International as well to help to implement that Alive and Thrive. And that's more about nutrition. That's more about feeding, more about how to improve the nutrition on the angle of, okay, this is what we have, this is the issue. Okay, for example, deficiency anemia, for example, and we want to teach the mothers how to teach their children how best to eat, how to train them on which foods are good for them to use for their cooking. And so we have programs where, in the Live and Thrive program, for example, we educate them from whilst they're pregnant, even whilst they have the newborns and in their infants, and teach them about the easy things to get. So we, with our partnership with Save the Children International, we're able to get that Thrive program moving them quite quickly. Also, we've worked with London School of Hygiene and Tropical Medicine, and they have helped us with research also, because we can't go forward without research. We have to make sure our programs are data driven, and that's what we work quite closely with, to make sure that we are using the proper processes that are proven to be working again and again, and then keep on emphasizing and improving and implementing our programs successfully. So among our partnerships are these, and going forward, our forthcoming partnership would be with Fortify, and that would be the one regarding, we're planning to break into tomato paste fortification. As I mentioned earlier, iron deficiency anemia is a heavy issue in the world, not only in Nigeria, and so also affecting Latin America. And so we are partnering with Fortify there right now, ongoing partnership at the moment, to implement fortification of tomato paste. The reason why I chose tomato, as simple as it sounds, is because it's exactly that. It's simple. It is a solution that we use so much tomato in Nigeria, and I also believe other countries as well. It's quite a simple base for a lot of stews and sauces, and so it's an easy, no-brainer way to improve fortification. So our partnership there as well is ongoing, and we are hoping to even receive more support in this plan to fight against iron deficiency anemia. But yes, I cannot overemphasize the importance of partnership and collaboration in tackling this issue. Thank you for this question.
Speaking my language as Senior Director of Partnership Development. So I want to stay for a moment on anemia, because you referenced a roundtable that we held earlier this morning. And of course, those roundtables are off the record, so we won't go in depth into it. But coming from that and thinking about nutrition and early childhood nutrition specifically, and the impacts that anemia and low nutrition have in the early years of childhood development, what do you think is key for a Latin American and Caribbean context coming out of that roundtable today?
Thank you. Yeah, so that roundtable was exceptionally amazing. I must say, we had fantastic people. And one of the key things everyone spoke about there was the importance of collaboration. And it cannot be overemphasized. For example, we have this amazing products. Let's speak about Lucky and Iron Fish. And there they have this fish or leaf, depending on the environment choices. And you just boil the fish in water for a few moments and take it out again. It can be reused several times. And that water can then, it's iron fortified. So it can be used to make other foods. Like in Nigeria, make yam, make rice, other things. And it's an easy, no-brainer way to increase iron uptake in families. And that was an example. That's one method. However, we also mentioned that there were issues with people taking pills. Like for example, mothers are happy to take pills when they're pregnant because they're caring for their child. But children are not likely to taking pills, as we've seen with children forcing them. And like, no,
you have to have the little Flintstone vitamins. Yeah.
So when that happens, we've seen that there have been challenges on other fronts. There have been such successes, but we see how there has to be changes in the way in which it comes in, which is why it has to be more holistic. School, with the school program described earlier on, increasing, like using your teachers involved in helping them to tackle these areas. If your teacher has a treat that goes with he taking that one pill a week, maybe it will increase uptake. So it was the echo of that conversation was that we have to work together. It's not an individual exercise. It's not even only a governmental exercise. Yes, they have a place. Political will is very important, and it plays a key role in making sure these policies come into place. But as a whole community, the private sector, the public sector, the NGOs, because they're the ones right on the ground as well. They're the ones who can reach the ground. As I explained in my midwives example, they're the ones who go right to the communities, who have the access to the communities, who have the trust of the communities. So we need to use all these different aspects to come together to produce an answer to our solution, to our challenge. And hopefully we should be able to, going forward, if we harness the power of collaboration.
And I think it goes back to what we spoke about with Mama Care, wherein the solutions you were kind of lauding here, the tomato paste, the happy little fish, these are simple solutions that meet people where they are. People are preparing meals, right? And so it's thinking through what makes sense in a daily context. It can't be a hard to reach answer. It's got to be something that that the whole community can embrace and make a pattern out of. So I suspect the reason I have the pleasure of speaking with you today, rather than one of those esteemed subject matter experts from the roundtable this morning, is the Concordia Action Alliance, to which Wellbeing Foundation Africa is an inaugural member of. And Kevin mentioned this in setting up the conversation, but the Concordia Action Alliance was designed this year to help enhance that collaboration you spoke of, specifically as it pertains to natural disasters and global health matters. And so when we're thinking about maternal well-being and childhood nutrition, of course, this fits into that mandate, and we're excited to be working with the foundation to help spur partnerships. So in thinking through with the Concordia Action Alliance as a platform to build partnerships, but also a fund to catalyze partnership activities, I would love to hear from you. No commitments, but maybe a prediction, maybe a wave a wand if anything was possible. Where would you be in 5 years when it comes to Latin America? What kind of programs would you like to see scaled from a West African to a Latin American Caribbean context? What does success in 5 years look like in this space?
All right, the commitments.
No commitments.
We would want to see a Latin America that is more holistic in its approach. And I think that would be involving more of the private sector, the NGO sector, which would be the sector that is able to get through the ground. I think we have the policies, we have the ideas. WHO has been fantastic in sharing us ideas about what we need to do. Now it is the implementation. And I think that is where we have challenges. So I believe if we want to succeed, success would be a world where women can give birth safely and give birth to children who are healthy, who also grow up healthy. That would be success, beautiful success, happy story, sunshine, everything like that. But for us to get there, we need to have more collaboration. And I would say a world where we can use intercontinental collaborations. It doesn't have to necessarily be wisdom and support and evidence has been shown, can get anywhere. If it works in Africa, it very likely can work in Latin America. So I would like to see a world where our program, for example, the Mama Care program, is implemented in Latin America and is able to see how powerful it can be if you take that step-by-step position with the mothers and change the lives of entire families. Mothers give feeding, mothers help to cook, wash, everything. They're the ones that are quite the home, the center of the home. If you can help the feeding of mothers and help the health of the mothers, you help the health of the entire nation. So that is what my belief would be: partnership and collaboration to achieve our central goal.
Lovely. Maternal health is certainly not simply a women's issue. And in my world, I would love to see a space where Concordia and Wellbeing Foundation together work towards building that type of collaborative, holistic approach. So if you're interested in this subject, feel free to reach out to Concordia, and we would be more than happy to connect you with Dr. Peters or somebody on her team to explore potential collaboration here through the Concordia Action Alliance. With that, I would love to turn it over to Kevin, who I believe is going to bring us to some more conversations that maybe center around women, but are certainly not specific to them.